Understanding mental health, exploring the 10 most common mental illnesses. Warning. Before we start, a quick note. This video includes discussions about mental health issues, including eating disorders and PTSD. Viewer discretion is advised. What is mental illness? Mental illness refers to a condition that affects a person's thinking, mood, or behavior for an extended time, impacting daily life. The National Alliance on Mental Illness defines it as a condition that disrupts how someone thinks, feels, or functions. You may wonder, is depression a mental illness? What about anxiety? Yes, they are, and they're among the most common types. In this video, Mind Health and You will walk you through 10 common types of mental illnesses. Anxiety disorders. Anxiety disorders affect about 18.1% of adults in the United States, meaning around 40 million people struggle with anxiety each year. Yet only about 36.9% receive help. Anxiety can appear alongside depression and includes disorders like generalized anxiety disorder, panic disorder, social anxiety disorder, and obsessive-compulsive disorder, OCD. These are characterized by intense worry that impacts sleep, relationships, and daily life. Fortunately, treatments like therapy and medication can provide relief. Personality disorders. These disorders involve behavioral and emotional patterns that differ significantly from cultural norms. Approximately 9.1% of the population shows personality disorder traits, causing distress in areas like self-perception, emotional responses, and relationships. While these disorders aren't curable, therapy and medication can help manage symptoms. ADHD and deficit hyperactivity disorder. Often associated with children, ADHD affects people of all ages and includes symptoms like difficulty focusing, forgetfulness, and restlessness. ADHD comes in 3 recognized types: combined, hyperactive impulsive, and inattentive. While medications are common, many also benefit from life coaching, education, and therapy. Post-traumatic stress disorder. Around 6.8% of the U.S. population, or about 19 million people, may develop PTSD. This can result from traumatic events like natural disasters, abuse, or extreme stress. PTSD and complex PTSD involve lingering anxiety and flashbacks that interfere with daily life. Therapies such as EMDR and cognitive behavioral therapy, CBT, are often effective treatments. Depression. Affecting about 6.7% of the adult population, depression goes beyond temporary sadness, presenting as a low mood that may last for weeks. Symptoms vary, often influenced by gender. Treatment options include CBT, interpersonal therapy, and medications. Bipolar disorder. An estimated 2.8% of people in the U.S. are diagnosed with bipolar disorder, a condition characterized by mood swings that can be intense. Ranging from manic highs to depressive lows, this disorder can be managed with medications and counseling. Eating disorders. Around 2.7% of individuals who seek mental health support are diagnosed with eating disorders. These disorders often involve cycles of restricting, binging, and purging, driven by distress over body image. Recovery is possible with therapy, residential support, and medications. Obsessive-compulsive disorder, OCD. Approximately 2.3% of people may be diagnosed with OCD in their lifetime. OCD involves recurring uncontrollable thoughts, obsessions, and actions, compulsions, to reduce anxiety. Treatment includes both therapy and medication. Autism spectrum disorder, ASD. ASD affects around 1.2% of children and presents challenges with social interaction, repetitive behaviors, and restricted interests. Treatment options include specialized education, ABA therapy, occupational therapy, and medication. Schizophrenia and psychotic disorders. Around 1% of the population will experience psychosis, often beginning in adolescence or early adulthood. Symptoms can include hallucinations, paranoia, and disorganized thoughts. Schizophrenia is the most common psychotic disorder, with treatment involving medication and therapy. If any of these mental health issues have affected you or someone you know, please share your experiences in the comments. Remember, this information is for educational purposes only. If you or someone you know needs support, please reach out to a mental health professional, community services, or a crisis hotline. Thanks for watching Mind Health and You. For more mental health insights, subscribe and stay tuned.